Okay, good evening, everybody. I am just going to let the list of attendees populate a little bit before I do our formal introduction and begin our meeting. We'll just give it a few seconds here. Okay, so it looks like the attendees are populating now through Zoom, so I'll go ahead and start the meeting. This will call to order the July 12th, 2021 public meeting of the Ayolero Community Advisory Council. This meeting is being held via Zoom in accordance with Executive Orders N-25-2 and N-29-20. This meeting is available by Zoom either through the app or by telephone. Spanish translation will be provided as an accommodation if a request has been made in advance. And Spanish translation, when provided, is done so through the Zoom application. You must use version 4.5.0 or later. If you do need accommodations for Spanish translation, or if you have a disability which requires accommodation, please contact us at 707-565-1534 or by email to cac@sonoma-county.org. Regarding public comment tonight at the CAC meeting, members of the public are free to address the CAC. Public comments should fall under the subject matter jurisdiction of the CAC and are time limited. The time limitations will be at the direction of myself and the co-chair and may be adjusted to accommodate all speakers. Today on the agenda, I'd like to start with our roll call. Ms. Barrera, would you please, or Vice Chair Barrera, will you please do the roll call for this evening?
Of course. Good evening, everyone. Councilmember Bailey?
Present.
Councilmember Estrada?
Present.
Councilmember Landaverde?
Present.
Councilmember Roman Diaz? Councilmember Solomon? Councilmember Woods?
Present.
I am Vice Chair Barrera and Chair Zelig.
Present.
Thank you.
All right, great, thank you.
Kevin, I'm sorry to interrupt. I just heard from Alma and Roman Diaz, and she is driving back from Sacramento, will not be able to make the meeting.
Okay, thank you very much. Are there any changes to the agenda that anybody has, or Adriana, are there any changes that we need to address on tonight's agenda? No, okay. I will now open this briefly to public comment so that we can discuss the minutes and the approval of the minutes for the last CAC meeting. I'm only opening up public comment for those people who wish to be heard on the approval of the minutes from the last meeting. So I'll go ahead and open that up at this time. If there's anybody who wishes to make public comment solely on the agenda topic regarding approval of last meeting's minutes. All right, I do not see any hands raised. All right, therefore, is there a motion by one of our CAC members for the approval of the minutes from the last CAC meeting, please?
I can move to approve the minutes. Councilmember Estrada.
Thank you, Councilmember Estrada. Is there a second of that motion?
I second that.
Thank you, Mr. Landaverde. At this time then, I'd like to call for a vote on approval of the minutes from the last CAC meeting. All those who are in favor of approval, who were present, please raise your hand and say aye.
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 And all those who are not in favor or disapprove, please raise your hand and say nay. And I hear no response for nays. Okay. We will move on to agenda item number 2. I'd like to introduce and call to your attention some of the new and reappointed CAC members. First, we have a couple of reappointments. The two CAC members who are being reappointed are Jose Landaverde, who is the at-large appointee from Iolero, and Dora Barrera, who has been reappointed by the supervisor from District 1. Thank you both. I'm glad you're both reappointed and back joining us on the CAC for another 2 years. Thank you. The new individual we have joining us tonight is Nathan Solomon. Nathan is joining us as a representative of the 1st District, recently appointed. And Nathan, good evening. It's nice to meet you formally here at the CAC. I wanted to find out if there's anything you'd like to share or tell the CAC and members of the public as we welcome you.
No, thank you so much. I'm really happy to be here, and I'm looking forward to tonight's presentation and also just being on the council for the next couple of years. I'm from Sonoma County. I was raised in Sonoma, and I've been living here in Santa Rosa for the last 14 years. So I'm really proud to be on this committee and looking forward to the work.
Great. Thank you very much. Okay, I'm going to open up now the agenda item 2 for public comment. This will be public comment for anybody who wishes to speak solely regarding agenda item 2 regarding the introduction of new and reappointed CAC members. I do see one person with a hand raised. That is Michael. Michael, when you are permitted to talk, please go ahead. You will have 3 minutes to speak. And again, this is only for purposes of speaking as it relates to the new appointments on the CAC.
Okay, thank you. I just, I didn't have anything to say. I wanted to test to make sure the raise hand function works. So that's it.
Thank you, Michael. Yes, it does. All right, thanks, Michael. If you do wish to make public comment later on, please do raise your hand again. Okay, so now we're going to turn over to agenda item 3. This is the main, one of the main items on our agenda this evening. This matter is regarding the city of Santa Rosa and their new Cahoots-inspired crisis intervention program. Briefly, I just wanted to let people know, Cahoots is a program that was started in 1989 as a mobile crisis intervention program. It was originally started in Eugene, Oregon. It is the Crisis Assistance Helping Out on the Streets, which is Cahoots. It is now a program whose model was used to start some programs in Denver, Oakland, Portland, both Oregon and Maine, and Olympia, Washington. Other cities around the country are looking at this Cahoots model as a way of dealing with crisis intervention on the streets, as opposed to having police officers responding to each and every call, including those which are clearly mental health and crisis intervention calls. Obviously, the city of Santa Rosa is not within the jurisdiction of Iolero, being that we are focused more on the county and the sheriff. However, the reason we wanted to have Santa Rosa present this regarding their Cahoots-inspired model is to look at how agencies and jurisdictions are implementing and looking into these programs, so that we can look at how a program like this may be something to benefit our county as a whole, and something we may then make recommendations about to the sheriff at a later time. And so we definitely wanted to hear about the city's program and how they are implementing that, so that we can decide how it may benefit us making recommendations to the sheriff's office. This evening, joining us for our presentation is Captain John Cregan from the Santa Rosa Police Department. We have Santa Rosa City Council member Tom Schwelhelm, Division Director Bill Carter from the County of Sonoma Behavioral Health, Director Mary Frances Walsh from the National Alliance on Mental Illness, NAMI, and Chief Westrop from the Santa Rosa Fire Department, and Scott Westrop. And each of them are going to speak to us about different aspects of this Cahoots-inspired model. So first, I will turn our presentation over to Captain John Cregan from the Santa Rosa Police Department. And welcome, Captain Cregan.
Well, thank you so much for inviting us here tonight. And I'm going to start off this presentation by telling you just a little bit about where we got started over a year ago and kind of where we're going next. But the key thing for everyone to understand is this has been a key partnership between our city, between some of the representatives we have here tonight have been such key partners in it, but some of the local nonprofits and from our community. And we wouldn't be here today without some of these partnerships. So myself, I've been a police officer for a little bit over 22 years, and I'm a captain at the Santa Rosa Police Department. I've served on the board of NAMI since 2018, and we quickly were able to get NAMI involved in this. And the reason why I joined NAMI is just seeing like we need to do a better job with providing some of the mental health services here in Sonoma County. And we wanted to build a stronger partnership between their organization. And we've seen a lot of progress over the last 3 years, but this is one of the most exciting moments in the city of Santa Rosa. And we're so glad to be a part of it at the police department and with our local NAMI office and partnering with our fire department, which has been a key part of our success with this. And then we're really excited to get the collaboration with the county's behavioral health department and the sheriff's department so we can work toward making this a county-wide response model. So I'm going to share my screen here. We're going to go through a quick PowerPoint, and then we'll definitely be able to take some questions at the end. So we'll start for the first one. Mr. Zila kind of set the stage here. Like it's something that we started working with Whitebird Clinic, and Whitebird Clinic is the nonprofit which runs the Kahoot program in Eugene, Oregon. And they also run the adjoining city of Springfield, Oregon, the Whitebird Clinic there. So we heard from our community and from people across our county that this was a national model. So we reached out to them early on, actually last July, in July of 2020, and reached out to them. But at the same time, literally hundreds of agencies across the nation were reaching out to Whitebird Clinic as they kind of got shared through social media and through other platforms about what a great program they have there. So they were kind of inundated with these requests over at Whitebird Clinic. But what set the city of Santa Rosa apart early on is our strong community support and our support from our city council members and from our city manager. Our police and fire chiefs were both excited about this. So we were very happy that we were able to be one of the select few cities in the nation that signed a consulting agreement with Whitebird Clinic. And what we wanted to do was not start all over and reinvent the wheel, but we wanted to as closely mirror what they're doing so successfully in Eugene, Oregon, and try to replicate that here in our own community here in Santa Rosa. So right around the first of the year, we're able to actually enter into that consulting agreement with Whitebird Clinic. I meet with them regularly, at least once every other week that I'm meeting with them, talking with their staff. I'm getting their policies, their procedures, their training outlines, and looking at even like pictures of their vehicles and everything we can to replicate what they're doing so successfully over there. And like we mentioned earlier, they started in 1989, so they're not new to this. They've been doing it for years. And in 1989, it started with just one representative, and it's grown now to a 24/7 response model, which is what we want to do here for the city of Santa Rosa. Like I talked about this, it's just due to our strong city support, both from our community and our city leaders that got us here, of kind of standing out from the pack from all the other cities who were involved. And I really think having that consulting agreement is going to help us to be so much more successful in our end product. And instead of us taking 30 years to get where Whitebird Clinic is, I feel very strongly that we're going to be able to reach their same success within the next year or two here in the city of Santa Rosa. So what I really want to dive deep into here is like for our model, we kind of call it affectionately a Cahoots Plus model, because we've examined what they're doing in Eugene, Oregon, and we've made some enhancements to that program. And we think that will more specifically meet the needs of our community. So the four major prongs of our program are listed right here. And the first is having a licensed mental health clinician. And we're going to be talking with Deputy Director Bill Carter a little bit about that and the county's key part in providing that. And that's actually an enhancement from the Cahoots program of actually having a licensed mental health clinician. And that goes through a little bit more training and expertise in this state of California and a licensing test that they have to go through to get that. We're also going to upgrade by having a paramedic versus an EMT. And the paramedic, and Chief Westrope's going to be able to dive deeper into some of the details of that as well. But the paramedic is going to give us a greater ability to assess medical needs with those that we're responding to and having contact on the streets, and a greater ability to be able to treat them in the field and divert them to go into some of our local ERs. And we think it's such a key partner by getting our own Santa Rosa Fire Department to be part of this team with their expertise. And it continues the theme of what we're doing, which is collaboration. And that's collaboration with our city departments, with our nonprofits, with our community, and with the County of Sonoma. The next part that we're really excited about is our homeless outreach specialist. And when we started looking at other teams across the United States, and I look very closely at the STAR program in Denver, and then what they're doing there with the Whitebird Clinic in Rochester, New York, which has started a team. And they were all seeing like in the range of around 60% of their calls were homeless related that they were going to. So we added this homeless outreach specialist, which is going to be right there in our vehicle. And they're going to be able to provide immediate resources for some of our vulnerable, unhoused members of our community to be able to provide that. It's important to understand that this team is not going to be only going to homeless calls. We'll be going to every call of housed people and unhoused across the city of Santa Rosa. But the data has shown us that it's going to be a key part of our team. So we want to have that component as part of our team. And Catholic Charities has had a long history of working with unsheltered here in Sonoma County and working with the city of Santa Rosa. So we were able to get Catholic Charities to come on board to be a key part of our team. And then another component that we're really excited about is our wraparound support services. And one of the weaknesses that I was seeing with some of the other teams across the United States is that they were really good at responding to the moment of crisis. So right there when they're in the crisis, but then someone was going to the crisis stabilization unit. And when they got out, the team wasn't having the contact again until they were in crisis again. And for us, that's a failure. So this wraparound services is going to be through our Buckaloo programs, which has a long history of mental health and some homeless connections here in Sonoma and Marin counties. And we're going to have 2 people who are embedded in our office, and they're going to be following up with people who our team has contacted throughout the week. They're going to be doing proactive outreach to some in our community, and they're going to be doing some of the other kind of upstream approach, we call it, that we'll talk about in some of our scope of work, which is helping people make sure they're getting their meds filled, make sure they're going to doctor's appointments, and make sure that they're reading other appointments that keep them from ever going to crisis in the first place. So some of the key partners we talked about, and I'll let them speak more in detail today, is the Santa Rosa Fire Department with our medical response, the County of Sonoma with their mobile support team, which is going to be embedded in our vehicle and filling that role of the licensed mental health clinician, Catholic Charities with their filling the homeless outreach component, and then Buckaloo programs focused on our wraparound services. And that's going to be focused both on mental health and substance abuse issues. The next thing that I get a lot of questions when we're doing community presentation is about like, what is really the scope of their work or what this team is going to be going to? And it's rather broad, but I do want to make it clear that it's going to take us some time to build up the capacity. So we're not going to be, I'll talk a little bit later about some of the hours we're going to do. So it may take some time for us to build up the capacity to each one of these, but these are our core goals that we're going to be focusing on. The first and obvious one is individuals who are in immediate care or treatment of mental health illness. So when they're in crisis, then we're really going to be focused, and some people don't understand this, but people who are intoxicated or under the influence of a controlled substance. So like a scenario you may see that is if we get a typical call that comes into our 911 center, our police records, is an intoxicated person who's at Old Courthouse Square in Santa Rosa. So right now you often have 2 police units that respond to that call. And if there's any type of medical component, you'll have an entire fire engine and an ambulance responding to those calls. So quite a bit of city resources. But under this plan, we'll first be able to send out our mental health response team, which is going to assess, and it's going to be, is it someone who's in need of a mental health services? Is it just someone who's intoxicated or under the influence of a controlled substance? And if so, if it's just an intoxicated subject who just needs some help, they'll be able to provide resources. Our paramedic will be able to assess them on the scene, and they'll actually transport them in a van that they have, not a police van, but this regular van that has seats in the back that they can sit comfortably, not restrained or handcuffed. And they'll transport them directly to our Orinda detox facility. If they need to go to the crisis stabilization unit, they transport directly to there, or if it needs to be services that we can get them into a homeless shelter, that team will be able to make the contact, provide the resources, and do the transportation without a police unit ever responding to the scene. In most cases, unless there's a need for a more serious medical care, we wouldn't have a fire or an engine or an ambulance responding to the scene. So it's a lot more efficient use of our city resources. And the most important thing for us, we're giving what we think is actually an enhanced service to these individuals. So we're very excited about that. Welfare checks, and that's such a broad term, but you'll get sometimes of maybe someone standing in a corner talking to themselves or acting erratically or stepping out in the traffic. And this is another perfect call for our new mental health response team to be able to respond to that, have contact, provide the assessment, and then provide whatever services and transportations they can. We're going to be able to provide basic medical care for suicidal subjects or those who have harmed themselves, disoriented. So there'll be a lot, and that's a key part of having our paramedic on the rig. Delivering emergency and death notification. So this is another one of having that mental health clinician. Right now you have a police officer coming out, and we try to get a chaplain when we can. But when this team has the capacity, we're going to try to have this team to be able to provide that, and they can have some of those resources there. We're going to be the wraparound services that I talked about. We'll be doing some of this upstream approach, and it's so key because right now we'll have a police officer and the medics will respond out, and we'll take someone to the crisis stabilization unit. But there's not a lot of the follow-up appointments that we're able to do and be able to reach in. And we think by getting people to make sure they're taking their meds, they're going to their doctor's appointments, we're getting this part is really going to focus on never allowing that person to get back into crisis. And that prevents the 911 call from ever being made. So I think that's such an important part of our program that we're really excited to see what the effects, and we really want to start measuring what are the long-term effects of with having these wraparound services. And then a key part is the continuing to work with emergency shelter resources for those who need that in our community. And when our team has the capacity, they're going to be working with some of our largest homeless encampments, working with some of our existing services that we have here with HOST and with the county's IMDT team. They're going to be working very closely and collaboratively with these other homeless resources that we have in our county to provide the support for our unsheltered population. Some of the service restrictions. So it's really key that we talk on this. So this team, they're not armed. They don't have firearms. They don't have pepper spray. They don't have any weapons whatsoever. But then again, they do not perform any law enforcement duties. So that's a key part to understand. They don't respond to any call that's involving a crime, potentially hostile person or a dangerous person, any person that is armed in any way. This team doesn't have the capacity. So if you have a suicidal subject armed with a fire gun or firearm or a knife or any type of weapon, they won't have the ability to respond to it. But some people have expressed some frustration about that and say, hey, why can't they go to these calls? And it's just important for us to understand that the safety of our team members is critical to us, and they don't have those resources. So there will be times that a marked police unit still has to respond to these crises. And once they're stable, and once we've been able to make sure that the weapon has been secure and the scene is stable, now our mental health response team is still going to be able to respond to the team, be able to provide the enhanced level of services that we do not have now. If things are calm and the person is cooperating, they'll be able to provide the transport. And if not, they'll still be able to provide some resources, and they'll be able to focus on some of the follow-up appointments with that individual. So they're still going to be a key part of each one of our mental health calls here in the city of Santa Rosa. And that's the last part. With our current team right here, this will be limited to the city of Santa Rosa. This is a program funded right now completely by the city of Santa Rosa, so it'll be within our city's jurisdiction. But as we'll be able to talk with our collaboration with the county, having the county's mobile support team embedded in our team is helping us quickly expedite of how quickly we can start working toward this, make a more county-wide response. And that's going to be a key part of our presentation today, is our goal to see that happen. But that's going to take support from our political leaders and then additional funding and time as we continue to see what works best with this program. The next thing too is an important part is to understand the major police department involvement is only right here through the calls being dispatched. And we're again following the model that's set up in Eugene, Oregon. So they experimented with having like some type of a call taker within Whitebird Clinic, and it just didn't work. And the problem is they needed to have resources of someone who's going to be there 24/7. And so many of these calls, it was a difficult balance for them to understanding, is this going to be a police and fire call, or is it going to be able to go to the mental health response team? So the calls will come through our typical 911 dispatch center, but we're really focusing on enhanced training for our dispatchers so they can understand when to appropriately provide this, and then to really ask the probing questions. So many times when a 911 call first comes in, people are excited. That's why they're calling 911. And we're going to ask those questions of trying to see, can we safely send this team? what really is the threat, and they're going to be doing that type of threat analysis to be able to hopefully send the right resource to the right problem that's occurring in our community. Our team's going to have police radios, and they're going to get dispatched. They'll be able to call for police assistance if they need them on the call. And that's going to be a key part of making sure that our staff feels like they have the protection and the resources they need to safely be able to assist those in our community. The next thing right here, we get a lot of questions on. So this is the picture of the Cahoots vehicle in Eugene. Our vehicle is not here yet. It's been quite a year with COVID of trying to order vehicles. And so we have 2 vehicles that we've ordered, and they're exactly like this. They're the Ford Transit vans that they have, and they're white just like this. And so they're not going to have any police markings whatsoever on them. They're going to have just the name of our team. And I'll talk about that momentarily, that we've worked with a local branding company because we want to develop our own name. We're not going to be called Cahoots. We want to have our own unique name that meets the needs of our community. But our car will be just like this. And it's really important for us so people don't confuse it with a police car. People, I think it's going to be more inviting, and it's going to be, I think members of our community are going to be more willing to work with this team, making it clear that it's not a police vehicle. And that goes next right here. This is again, the Cahoots team. And it shows they don't wear police uniforms. They don't wear uniforms of any type. Actually, they're just going to have a t-shirt, or they have sweatshirts and things like that will have the name of the team, and they'll wear jeans and tennis shoes. And it's a much more approachable look. They're not going to have anything, nothing on their belt other than perhaps a cell phone, but no pepper spray or anything like that. So we're following this exact model. Even the makeup of the car, which you can't really see here very well, our vehicles are going to be outfitted exactly like Cahoots cars that we have there. Now, the next thing, and you're actually the first community group that I've shared this with. So we've been working for over 3 months now. We've gone through probably 45 different names and all kind of responses. So it's not really complete yet that we have still the coloring and the logo. It's still being worked on right now. But the name of our team is going to be In Response. And this is our local committee came up with this. And it's talking about we're in response to the cry from our community for change. And we're in response to our new mental health response model here in Sonoma County. And our tag team underneath is the mental health support team. But our team name is going to be called the In Response team. And we have some colors that are coming up. We're using the green color, which is kind of ties into the mental health awareness colors. And we have some other things that we're working with our team. And I'm going to have those for our public safety subcommittee on August 11th, when I'm going to give another update, and I'll have the full branding and the logo and the colors for then. But I wanted you guys just to see this about just our name. And then we really want to start focusing on people understanding what our team is going to be and our unique name of our team. Because a lot of times right now, even ourselves, we kind of refer to it as the Cahoots team, but we wanted to start kind of separating ourselves and share that. And I'd love to get some feedback from you when we go through the question and answer on the name and how it meets the needs of our community. Our next steps is we're continuing to meet regularly with Whitebird Clinic, and we're going to organize a community meeting with Whitebird Clinic. And I'll make sure that I send that out to your group, and we're going to be putting it on our social media platforms. So we've been meeting with some of the local stakeholders in the mental health and the homeless arena, but we want to make sure that we're getting continued feedback from our community. And I've done presentations to probably about 15 different groups over the last couple of months, and really seeking that feedback and trying to educate them on what we're trying to do. But this meeting is going to be Whitebird Clinic will be running it and continuing to get some more feedback from this. And for us, it's going to be a 12-month pilot program. And part of this pilot program is understanding we know we're going to have to make some changes. We know there's going to be some things that we're going to hear from our community. We're going to hear from our clients who are utilizing the services. So that's going to be a key part of us really understanding and being flexible for that first year. The name I just talked about. We're also exploring some funding. We've applied for several different grants. We're working with some of our federal legislative partners about some federal funding to come in from this and some private funding. And that's really going to help us to be able to more quickly get to that 24-hour or 24/7 response model. The vehicles, like I said, they've been ordered and we're working just on them to be delivered. It's just being delayed right now with COVID. Continuing to work with our key partners that you're going to hear from today. We're also really want to focus on working with some of our other allied law enforcement agencies across the county. So the city of Petaluma is really leading the way with this, and they actually launched a team this week. Their team is called the SAFE team, so it launched this week. It's a little bit smaller than this team. It has a paraclinician, I believe is the term they use, and it's going to be someone who can provide basic first aid. and it has a mental health clinician on that team, and they're going to be focused. So Petaluma is really moving on this too, and they kind of had a soft start to the team this week, and we've been meeting very regularly and working on how our teams can work together and share some of our dispatching procedures and some of our other procedures. Rohnert Park, the city of Rohnert Park, is also exploring and working toward starting a team, and then we'll continue to work with some of the other key partners across the county to understand that. For us, we're planning to optimistically still launch our team the first week of October. We still have a lot of equipment to come in and getting these vehicles done and getting our staff hired and trained, but we've been working literally nonstop on making that happen as a city group and with some of our nonprofit partners. We're going to start with 10 hours a day, and it's going to be 7 days a week from 10 hours. So the hours right now are roughly going to be from 12 in the afternoon till 10 at night, and that's our peak call volume time. And then we have a 3-year plan. So year 2, it's going to go to 17 hours a day. And then year 3 will be a full 24/7 response model. And if we can get the funding and the staffing earlier, then we'll go to that 24/7 response model even sooner. And it's a priority for our city to reach that as soon as we can. What does success look like? And so a big part of that, and Councilmember Schwedhelm is really into measuring the metrics, and he's going to be able to talk about some of that today. But that's important for us as a city to really look at how are we measuring the success of this program. We put a lot of work, we put a lot of city money into this. So for us, the most important thing is it's a better response model for those in crisis in our community. We're going to see a lot of other effects of that, but the biggest thing at the end of the day, we really feel like we're going to be providing a better service to those in need in our community. We think the wraparound services with so much more of a holistic look at the individuals who are going in the crisis is really going to help preventing people from having future incidents where they need to call 911. We believe that we're going to see with a full 24/7 response model, we believe we could see between 3,000 to 5,000 calls diverted from the police and fire department, and could be even in excess of that. We're going to be able to see for the first 12-month period. And one thing that I think is really important in working with NAMI and hearing from some of the communities, we know that there are some in our community right now who will not call 911 when they're in crisis, because they don't like the service that's going to come to their house. They don't want a uniformed officer. They don't want an individual with a gun coming to their house. They're nervous that it could escalate into a use of force situation. So instead, they elect to not utilize those services. So what we're really excited for is we're hoping that more people will be willing to call 911 in the city of Santa Rosa, knowing that there will be an alternative response model for them to come to support them and their family member. And so we're hoping that that leads to more people seeking out services and getting some of the help they need that they may be avoiding right now because of not having trust with the systems that we have in place. We're also hoping to see a diversion from our local emergency rooms for people, and that's going to be a key part of having our paramedic on the vehicle. And so instead of having people who really aren't in serious medical condition sitting in an ER bed for hours waiting for help, and that is diverting some of our emergency room doctors and others from giving those who are in more critical care. We're also, one metric that I really am excited about is I think that we're going to see a decrease in jail bookings for our mentally ill community. And we see often so many times that those who are in a mental health crisis, they're acting out, police officers get called and they ended up committing some type of criminal offense and they end up getting incarcerated. So what we're really hoping is provide these services that we're going to see less people booked into the jail. We're going to see less use of force by our Santa Rosa police officers. And then we're really hopeful that we're going to see an enhancement in the number of our emergency shelter placements, working with our unsheltered community and having Catholic Charities being a key part of that. These are just some of the basic metrics that we're going to be looking at. But honestly, we're really looking holistically as a city about what are the impacts to the fire department, to the police department, to our homeless population, to the jail. We're really going to be able to sit back, I think, after a year and evaluate what the success has been, and then also really starting to look internally about what changes do we need to make this even a better program. So I know I went through that really fast because I didn't want to take time from other things, and I'm kind of a fast talker. So here's my information. I really love to get calls and emails from the community about questions you have. And it's really helped us when we're hearing concerns from our community to help us design the program that meets the needs of what our community, and especially those who are going to be utilizing the services. So please call me, email me anytime, and then I'll turn this presentation back over. I'll quit sharing screen. And then I'm open for any questions, and we can have our other panel members step in and talk about their respective roles in this important project.
Thank you, Captain Cregan. Before we turn it over to the next panelist, I'd like to open it up to our CAC members to see if there are any questions for Captain Cregan about the presentation he just gave, or about his presentation regarding the in-response team. Mr. Landaverde, I do see your hand raised. Go ahead if you have a question for Captain Cregan.
Hello, Captain Cregan. Thank you for your presentation. It was actually quite insightful, and thank you for sharing the name that we're going to be seeing out on the streets. Obviously, the media, when they see these, the optics is that they want a in-response type team when you have someone wielding a knife or somebody that is having a mental crisis. But you said that there is those calls they will not be going to. Is there in the future maybe some type of merging where there will be some intervention where that maybe that group can be on standby and also be in case of the situation escalates when there is a weapon or something? Meaning, will there be something additional? Because a big part of it is that where we see the deaths and the shootings is when there is, well, sometimes there isn't a weapon. There is an assumed pretension that there was a weapon, but will there be some type of merging? I hope I made sense to my question.
Yeah, absolutely. That's a really valid question. So the key part of this is balancing the safety of our team. So if that person with a knife were to charge our team and they're unarmed, but where we're going to be able to do is our in-response team is going to be meeting, going to our briefings with our officers and providing training to them. They're going to be working with the fire department. And on a scene like that, where I envision is that this team will stage 2 blocks away. So they're safely able to wait in that our officers could be on phone contact with them, talking with our mental health clinician, getting advice from them because they have a much more advanced level of training and expertise in dealing with this. And they'd be a true asset. And as soon as the scene is secure, our in-response team would be rolling up and providing some of those services. So they could still be a part of the de-escalation efforts and still supporting without putting themselves in a position of danger. And then I think that training component is going to be so important. Right now, both the Santa Rosa Police Department and the Sheriff's Department send all of our uniformed personnel go through the 36-hour CIT training. So they have some basic level of training, but to be honest, we need more. And so that's where I think having that licensed mental health clinician there to provide that resource and guidance, and then for us to continue to work on some of our de-escalation tactics of giving some time and distance in these situations, is going to hopefully get there so we can start seeing a more safe resolution and more often in these incidents.
Great.
Thank you, Captain.
Thank you. Councilmember Estrada, I see your hand raised.
I had 2 questions. So the thought about after the year reevaluating and see how it's changed and the impacts, is that going to be public information that you're going to share? Is there going to be, like, I don't know, maybe on your website, any sort of information listed? Because I think that would be really, really helpful just to have out there. And my second question is, you also mentioned that it would be, sometimes people don't call because they don't want an officer responding to certain situations. Is there any thought of, like, when someone calls to the police department, could they request the in response, or is it just going to be like the person on the other line deciding if in response is going to be, the dispatcher deciding if in response is going to go to that situation?
Yeah, 2 great questions. So first, we will have, and one of our things that's important for everyone to understand, we launched last year the City Council Public Safety Subcommittee. So that's 3 members of the Santa Rosa City Council who are focused on some of the public safety issues. So we'll be doing probably quarterly, if not at least every 6 months, updates to the Public Safety Subcommittee. And that's a key part where the community can come together, hear those presentations, be able to provide public input. And a big part of that is going to be on developing the metrics. And I'll let Councilmember Schwedhelm talk a little bit about that. He sits on that committee and he'll be able to talk about his role in that and the expectations that he has for us as a city leader of us providing information and making sure the community is aware, what did we learn, and help the community be part of where do we want to go for year 2 with this program. So, and then the second part, that's a good question. So we will have people who can say, I want the in-response team to respond. And we have that now with the county's mobile support team, we'll have people call and say, I want mobile support team to respond. And the current county protocol is a police officer or deputy sheriff has to respond to the scene first. So yeah, what we want to do, and we're really going to work with our key partners like NAMI here to educate our community and the people who are going to be utilizing the service. And we want exactly that, for people to call and say, I want the in-response team to come to my house. The dispatcher will still have a set of criteria that they'll have to ask about, is the individual armed? Do they have any weapons? Are they, how is their, or have they been hostile? So they'll still have a little checklist they'll have to go through. But our hope is that they're going to be able to go through that criteria, and we'll be able to get the in-response team to respond directly to them, and they'll never have a marked car come. And we've seen a lot working with the community, just the stigma associated with mental health. And some people, if you have your teenage child who may be having some type of a mental health crisis, and they don't want 2 police cars and a fire engine parked in front of their house, and all the neighbors are looking out the window going, what's going on? So that's where we're hoping this more kind of subdued white Ford Transit van rolls up, and it's going to have the in-response logo on the side, but that'll be the only vehicle that responds there. And I think it'll help reduce some of the stigma of reaching out for services as well. And then, like I really stress, then the individual will just walk out there, no handcuffs, no restraints. They'll get in the back of the car, and they'll get just a transport to some of the services that they need.
Great, thank you. Councilmember Bailey, I see your hand raised as well.
Thank you, Evan. A couple of questions. One is, I really do appreciate the name consideration and change, because I do think it's really important for the community to understand what this team is, and Cahoots just, I'm sure it means something, but it doesn't mean, and if you're not really in this and involved in it, you may not know what that means. So I think the consideration around the name is really important, just for also community impact. And then you may have mentioned this, but who is the lead? Like, who's the person we go to when we have an issue? Like, who is coordinating all of this? It sounds very collaborative and in partnership, but in the end, who is the #1 lead agency, or is there going to be a person in place that's going to be the coordination of this program?
That's a great question. Even internally in the city, we've been working on establishing that. So for year 1, this program was given to the police department to create a program to transform the police mental health response. So for year 1, it's going to be in the police department. So the chief of police is the ultimate overseer of this program. But for us, we don't want to make this all about the police department. So what we've done is we have a group that we're going to do. So it's going to be ultimately the chief who makes the final decision, but we have a steering committee, and that steering committee is going to be composed of the representatives. So we're going to have the fire chief, Scott Westrop, on there. We're going to have Bill Carter is going to be on there from the county. We're going to have Catholic Charities and Buckaloo on that program. We're considering putting one of our hospitals on there too, because they play such a key part in this. And so we want to have, and that steering committee is going to be really providing the chief. I'm going to be on there from the police department on that steering committee. And we're going to be really talking to those in our community, bringing forward the suggestions and giving them to the chief. And the chief is really going to rely on our experience. But ultimately, the chief reports to our city council and our city manager. So they're the ultimate decisions about where we want to go. And honestly, where we're going to be getting the feedback, not only as a police department, but as the city council and our city manager, is what does our community want to see for this team? And then we're going to build a group of stakeholder group. And that's where we're going to have some of our key stakeholders from the county. Mary Francis from NAMI is going to be on that stakeholder group. We're going to be working with some of our other key partners like IMDT from the county to be on that stakeholder group. And that's going to be really, we have kind of our feeling the pulse of our community about what are the needs and how can we be better utilizing this team. And then we'll have obviously our group on the ground level of this team from Catholic Charities and Buckaloo and the fire department, who are really providing the in the field services every day. And then, but again, it's important to understand this is a 12-month pilot program. I envision this being here to stay for the city of Santa Rosa, but that's one of the things we want to look at and hear more from the community and the 12-month program about where eventually does this program run out of. And that's something that we're really going to be examining for that first 12 months. And quite honestly, I see us making some changes after the 12 months about where exactly this lands and where we go with it.
Great. Thank you, Captain Cregan. Councilmember Solomon, you have some questions for John Cregan?
I do, thanks. Thank you, Captain Cregan. So I guess my first question is a little more basic, and you almost addressed it in your presentation, which was great. Thank you very much for the presentation. But what percentage of total calls coming into SRPD require mental health services?
you know what? That's been out of the last year. That's been something I've been really diving deep into. And what's been frustrating to me is I can't honestly accurately answer that. And where this happens is the mental health calls get entered with such a wide array of calls. So you'll get a subject, a suicidal subject, or you'll get a disturbance, or you'll get a theft, or you'll get a vehicle collision, or you'll get a fight. But then when the officer responds there, say, okay, it might have been a fight, but really what it is someone who is experiencing a mental health crisis and they're exhibiting the signs of that crisis. And unfortunately, what happens right now, a lot of times it gets focused on the fight and they end up going to jail, and then they get their mental health services in the county jail, which is not the most appropriate place for them. So that's one of the things that we're doing is we're creating some new like DISPO codes, as we call them, for our officers and for our team to do a better tracking mechanism about what are the mental health calls here. And I think that's going to help us as some of the policy decision makers for the police department and the city to have a better understanding of that. So from anecdotally looking at the information and from our experience, right now the police department goes to around 145,000 calls for service a year that the police department goes to. We think that are actually going to get diverted to this team with a full 24/7 response model. It'll be around 5,000 calls that a police officer would never go to. But honestly, when we're really going to know that is when we get to the end of our 12 months. And we have a lot of mechanisms we're putting in place to really capture that data of how many calls exactly this team went to, how many calls did still the police and fire department go to that were outside of this team. And then we really want to start hyper examining how can we increase that number that our in response team is going to and minimize the calls that our police and fire team have to go to that are directly related to mental health and substance abuse.
Yeah, if I'm a decision maker, right, I have to have that information to make choices about funding and expectations and what does success look like. I think that was a good slide, but without knowing that, it's really hard to make good calls, I think, on those.
Yeah, so the numbers we can give is like we can tell the number of people who actually got put on a mental health hold, and we can tell how many people got transported to the crisis stabilization unit or to the Arenda detox facility. But what we know is there are a lot of mental health calls that don't. They get resolved in the field there. They don't end up in a transport. So that's where we're really going to start diving into those numbers. Are so many of the calls, they end up getting handled criminally, like I talked about, and they aren't treated as the true mental health emergency that they are. So that's where I really want to start looking into those numbers. And I think this pilot program, that's been a key part of it for us, is building mechanisms in place to track those numbers more accurately than currently we have systems to do.
And hopefully that DISPO codes are not mutually exclusive, right? You can have a homeless person with mental health issues.
So that was specifically came up. So we worked. So right now we have a DISPO code that's like homeless related incidents right now. We created that 3 years ago, and it's been tracking around 17% of our calls for service are homeless related. And that could be homeless related from a fight or serious act, or just simple calls of someone sleeping in a doorway. So about 17% of those calls. So we created a new DISPO code for mental health related, but then exactly what you brought up, you're going to have the component of both homeless and mental health. So we created a third one for that. So those are all DISPO codes, and we're working actually to make that county-wide so our other allied agencies can start focusing on that and gathering that data, and then can start internally examining their own organizations about what the impacts are. So that's something that we've been working with our county-wide dispatchers and some of our other police leaders, and we're just launching that this month.
Great, thank you. Ms. Navarro, Iolero Director Navarro.
Hi, thank you. Captain Cregan, you touched on my question in your last discussion with Mr. Solomon and before when you were responding to Mr. Landaverde. And I'm wondering, a lot of times what we see in criminal law is a family member or loved one or even community member on the street contacting law enforcement because someone's having a mental health breakdown or in some other sort of crisis. Law enforcement responds, and you said earlier that there may be instances where law enforcement responds first to de-escalate or to make sure that the situation is safe. And what often happens is that the person who is in crisis also has a warrant for a criminal situation that has happened in the past, either it's serious or not serious, and that person ends up getting taken to jail where their mental health needs are taken care of at the jail instead of in a mental health facility. And I'm wondering if there's been any discussion about how this program is going to deal with those situations.
Absolutely. So we have had some discussions about that. And so the key thing to understand is this team's a non-law enforcement team. So like if they go out and contact someone at Old Courthouse Square or on the Prince Memorial Greenway or wherever it may be, they're not going to be like running them from warrants like a police officer maybe would do as a matter of procedure. So they're not going to have access to criminal databases to be able to check people for warrants that are in response team members. And that's not going to be their focus. Their focus is on providing some of the mental health and substance abuse services. But to be clear, if there were to be a call and we're going out to the team and we're going out and maybe someone knows they have a warrant, like so the police dispatcher recognizes, oh, that person's a wanted person. There will be some cases where an officer, and really it's going to be on some of those non-negotiable ones, and that's going to be on warrants for serious violence, for sexual assault, for domestic violence. Those are going to be some of the key ones where it's actually an order from a judge for us to be able to act. But the key is really going to be on balance. And so our goal is going to be focusing on that and to not be leading with running people for warrants, and especially with this team. But if it goes through dispatch, I want to just be very clear and transparent with that there will be times that if someone has a warrant for a very serious offense, that it will have to get handled with a police response. And then we can work with the wraparound services and support to follow up with that individual and give them the mental health support that they need. But the team is really going to be focused on low level things. They're not running people for warrants in the first place. And when someone just has a cite and release warrant and things like that they could work through that. So it really be, I guess, a case-by-case basis and really focus on the severity of the warrant. But I can promise you that the team is not going to be focused on that, and they won't have the capability even to run people for warrants or even know that.
Great, thank you. And then our last question from Councilmember Bailey for John Cregan, and then we'll go on to our next presenter.
Thank you very much. Quick question. We're talking about collecting a lot of data around impact and effectiveness. Will there be data collected around demographic data around the people served? In particular, I'm thinking about race. We know that that can be another layer to a lot of this work. And in the past, I know that hasn't been, I think we're going forward, that's something that has to be collected, but is there any talk about demographic data about the people that are served?
We have talked about that. And so we actually got just last week the program that they're using there in Eugene, Oregon, Cahoots program. So I got to dive deeper into that and see if it is capturing that the demographic data and things like that. But that is something that we really want to do. And we want to start measuring the unsheltered versus sheltered and looking at ages and looking at demographics. So that is going to be a key part of it. So we're looking at some different software programs that they're using there in Eugene, and we're going to see, does that meet our needs? And if not, maybe look at a more expansive thing. But I think that'll be key. And that's also going to be important for our community, for us to be able to report back, like, where are the needs most and who are utilizing. And then it may also show us some areas like, hey, these are some in our community who aren't utilizing the services. What can we do better to make sure that they understand that these resources are there? And I think that's where the men and women in this room can really help us, about getting the word out in this program and partnering each one of you and the communities you represent, the organizations that you guys represent, to help us get the word out on this program. And it's going to be upon us of building some of the trust and legitimacy with our team for our community to feel safe to call this team and have them help their family member or themselves when they're in crisis.
Sorry, Evan, one quick thing, and also diversity of the people who serve the people that to be served. Thank you.
That's been a key part, and we've been working with our nonprofits on that too, and making sure that we have bilingual capabilities with our team is so important to us, and we really want to represent the community that we serve. And so that's been a key part of our working with our different organization as we build this team and expand that team. I can promise you that you're going to see a very diverse team and a team that has the ability to speak with all of our community.
Great. Thank you very much, Captain Cregan. I'm going to go ahead to the next panelist presenting. Captain Cregan, is there a better order for this presentation that you believe we should go in, or just go to the next one that we have?
I think anyone works. Maybe Chief Westrop to talk about the medical component from it.
Sounds great. Let's turn that over then to Chief Scott Westrop from the Santa Rosa Fire Department. And Chief Westrop, whenever you have a chance, please go ahead and welcome to our meeting.
Great. Thank you very much for having all of us and for all your time. It's good to see some familiar faces on the screen. Haven't seen some of them in a long time. So good to see you all. So real quick, I want to talk about why the fire department's involved. And so it may be a question in some of your minds, like, why is the fire department involved in something like this? And from my perspective, I've been the fire chief for a whopping 4 months now. but I've been here for 21 years, and I really wanted to move the fire department into the 21st century. We tend to get wrapped up in this, 200 years of tradition impeded by progress kind of model where it's the same thing over and over. And so I'm really trying to progress the department as part of the thing. And when John and I started talking about this, and we actually started talking about some offshoot of this years ago within the fire department, but what I'm looking at it from, and the reason that we're involved, and I want everybody here to know that the true reason that the fire department is involved in this is that we think it's the right thing to do for the community, and we think this is the place we need to go, and we want to be part of that moving forward. We think it enhances the service to the community, and not only from the fire department and police department, from the entire city as a whole. So, and believe it or not, it is leaning forward, at least from a fire and EMS side of things, or emergency medical service side of things. It's leaning forward. In fact, we're actually ahead of the state at this point from a regulatory perspective. There's no capacity for what they call a community paramedic that doesn't transport to a hospital and things like that. So, so we're actually ahead of the state, but we're working with our state and federal legislators to actually move that ahead. It's the community paramedicine is in a pilot phase, and it has been for an extremely long time at the state level. So we're actually using this as a catalyst to move forward and get the community paramedicine program off the ground at a state scope level. And lastly, I really think, and it's hard for maybe you or I to understand this, but I think it's going to aid in de-escalation actually. Most people, they see a blue uniform and a badge. They don't bother to look to see if there's a gun or handcuffs on the belt. They think that a lot of times firefighters are police officers too. It's one of the reasons I don't wear a uniform very often, is to try to even, for instance, de-escalate this room. I'm not in here to be authoritative. I'm here to be part of the community and to be a leader in the community just like you. So, so I think it'll actually help in the de-escalation process as well. So when we started this conversation, we did a cost benefit analysis of what type of medical service we could provide from a city perspective, or even contracting out to a different entity to provide medical service. And what we landed on was a firefighter paramedic, and I'll explain briefly what that means. Is so first of all, it's going to be a firefighter. And the reason for the firefighter is because they have a different skill set. They have more tools in the toolbox, different level of training. So when they're presented with a problem, they may have that training, or if not, they have the access to that information through being an employee of the fire department. So for instance, they run into a fire prevention or a code issue out in the field. It's not a street or ambulance paramedic. It's actually a firefighter who either can deal with it because they've had that training, or they have direct access to our fire prevention bureau, building code bureau, or building code department, whatever the case may be. They're going to have that access and that training. And then the paramedic part, when you see an ambulance or you see a fire engine, typically you're going to see an EMT or emergency medical technician and a paramedic. So those are sort of the two field levels of training that you have. In some areas, you'll see nurse practitioners and things like that. We don't really have that in Sonoma County. So a paramedic's going to provide a higher level of care. So really what that means for this team is they're going to have the ability to treat differently. They're going to have the ability to treat more injuries in a different way. And one of the things I really like about the paramedic side of things is they have increased pharmacology education. So when you're looking at medications that the patient's supposed to be taking or should be taking, or are they contraindicated by another medication or something that they're taking that they're not supposed to be taking, they're going to have that level of training to help ebb that out and to work out the pharmacology side of things or the medication side of things. And the biggest thing is, and this may not matter to everybody in the room, but a paramedic in Sonoma County is the only field level clinician that has the ability to release a patient to either their own recognizance or to somebody else. And so that's going to be really vital for this team, is they'll be able to treat somebody. So whether it's the teenager who has superficial wounds to a wrist or an arm, or somebody who's unsheltered, who has an ongoing wound on their leg, they're going to be able to treat that, provide that level of care, and then release that patient either to a responsible party or to themselves. So then they can go into that next level of care, whether it's to a detox facility or to a shelter or whatever the case may be. So that's going to be that's a catalyst component of why we went with the paramedic. So that's sort of the firefighter paramedic reason we landed on that. Are there cheaper versions out there? Absolutely. But you pay what you get for. You get what you pay for. Sorry, it's been a long day. So you get what you pay for, and really what we like about it is it's a city employee that's on the resource. So it'll be on the in-response vehicle. And so there's direct access to all the city rules and regulations, and that also makes the team adhere to city rules and regulations. And they have direct access to management at both the fire department and police department level. And then to Councilmember Bailey, sorry, it's hard not to call you by your first name. I've known you for a while, but Councilmember Bailey's point, one of the things that we're working on is a recruitment and diversity plan. And so I really think this opens up the DEI aspect to bringing in different people into the job capacity of being in the fire department. So somebody who maybe doesn't want to go to the Tubbs fire or to house fires, but they want to provide that level of care. They have that clinician mind where they want to be out and providing a different level of care to the community. I think it opens up the DEI channels to have a different type of job available. And so I really hope that that actually helps us out in the diversity field as well for a recruitment position. And lastly, and probably least important to this group, but just so everybody's aware, because we run this type of business as it is, it provides us direct liaison to Coastal Valleys EMSA, which is a county organization that is the regulatory authority for EMTs and paramedics in the county. So we've already been in conversation with them because we're working within the rules. We're just sort of working around the rules also until we get this community paramedicine thing on board. So we're bringing them in early and working with our medical director on exactly what we're going to be doing. It also gives us direct access to Redcom, which is our dispatch center. So typically 911 calls will go to the police dispatch center first, but for a non-911 emergency, they may call Redcom directly. So it's working with our dispatch center to be able to dispatch the in-response unit as well. And lastly, it's direct access to the hospitals and the hospital liaisons. They have a big interest in reducing ER visits for, a sundry of issues, whether it's injury or illness or mental illness, but we're hoping to be able to keep people out of the ER and keep ER wall times and wait times down a little bit as well. So it gives us access to that level of care also. So that's sort of the why of we're involved and sort of the why of we went with through our cost benefit analysis of firefighter paramedic. Happy to answer any questions, but that's all I have at this time.
Great. Thank you, Chief Westrop. I think, I think that's fantastic that you're going with a paramedic model, and it makes a lot of sense with their ability to kind of triage that situation and determine if it is somebody who can and should be released or if it's somebody who needs increased level of care. And I didn't realize they were at the level where they could make that decision as opposed to somebody who's really just transporting for other care and they can handle it all there, which is great. Councilmember Woods, I saw your hand raised during the chief's statement. Did you have any questions for Chief Westrop or are you okay? Okay, she's signaling she's okay. Are there any of our CAC members who do have questions for Chief Westrop? Okay.
I just if we're there, I just wanted to ask Mr. Cregan a question.
Oh yeah, please go ahead. Go ahead.
So would we be able to get a list of the organizations you've reached out to? Because I'm a member of a couple of them and I haven't seen you or staff members anywhere there, just to make sure that all members of the community are represented in these conversations.
Yeah, I don't have them right now, but we've done the city's public safety subcommittee about 4 times that we've done. I've working with Community Action Partnership, with the Council on Aging, with Santa Rosa Violence Prevention Partnership, both their operational team and their policy team. I don't have the full list, but I'm also open to do anyone else. So if you send me an email with an invite, I'll be there. So just let me know the group and I'm happy to present.
Perfect. Thank you so much.
That's great. Thank you. Thank you, Councilmember Woods. Okay, so no additional questions for Chief Westrop. So if you think of some as we're moving on, please raise your hands and we'll come back. Thank you, Chief. Now let's turn to Santa Rosa City Council member Tom Schwedhelm, who can give us a little bit more information about the city's involvement in the In-Response program.
Yeah, thank you so much for the invitation. And Scott, I was waiting for a question for you, but maybe we'll see if we can get one at the end there. But thank you for having us here because this really is a community-wide conversation. And I just want to share with everyone that the whole start of this, at least from a city council perspective, we thought there was a better way, more efficient, effective way to deal with certain members of these vulnerable populations, right? Just having police officers respond to all these, that's not the best for the people who they're interacting with. So that's where we started collaborating, and it started with our public safety subcommittee, where we started talking what other models are out there. And as Captain Cregan shared, we've explored a lot of different ones. And one of the things that, why we're kind of doing this pilot program, we're not shooting for perfection, right? Because if we wanted to have this perfect model where we've thought of everything, anticipated everything, okay, we'll have it operational in 2025. We wanted to have some concepts. Cahoots was a great model. We got contracted with Cahoots, and we're ready to start moving forward. And one of the roles that I get to play on both the public safety subcommittee, but also supporting city staff, things such as anyone who's dealt with the bureaucracy, and we have budgets. The budget for this, city council approved third week in June, $1.1 million. Well, if you think about that, as Captain Cregan talked about, the vehicles you saw, you got to order those cars. Anyone have any idea, especially with COVID, how long it takes to get vehicles? Then you talk to Chief Westrup, all the medical stuff. A, it's not cheap. And B, it doesn't happen overnight. So hearing from Captain Cregan and Chief Westrup, and then I could have my own conversations with the then city manager saying, I'm seeing 100% support by the city council on this. I know we don't have the money yet, but I can assure you it is coming. So that's that collaboration that's not normally the way bureaucracy works. And so this collaboration is huge. Some of the other things that I mentioned, the $1.1 million, that's for the first year of operation, 10 hours a day. Now, as Captain Cregan mentioned, when we go 24/7, that's going to bump it up to 2.5 million. Now, one of the things too that I've shared with many community conversations I've had is that this is a community-wide issue needing a community-wide response. So have had conversations with some other community stakeholders that if someone wants to assist us getting this going 24/7 quicker, we need some funding. We need some funding. It's as simple as that, right? The city, although it's kind of a unique time, unprecedented time in the city's history where we have millions, tens of millions of dollars of one-time funding, right? And what we're talking here, the $1.1 million is for operational expenses. Yes, there's some capital expenses like the vehicles, but I don't think it's an appropriate use of one-time money because if it's not sustainable. So that's the thing that we at council are trying to look at other funding opportunities. One of the things I've talked with our lobbyists in Washington, D.C., there's some legislation called the Cahoots Act that's going through Congress that potentially may open up some Medicaid reimbursement if your team is 24/7 operational. So it has not been passed yet, but again, we're already talking with our lobbyists. We need to stay on board with that. How can we support that? And then it also comes up, I know a lot of the questions have come up into the regional approach to this. This clearly, we have not started, day one, I know talking to John, hey, let's talk to Bill Carter, make sure that the county's on board here. City of Santa Rosa is not looking to doing this in an island of itself. We see, ultimately, we would love to see this as a regional approach. I've had, John talked about the folks that he has talked with. I've had personal conversations with the Rohnert Park chief, the city managers from Rohnert Park. Last Thursday, I talked to Sebastopol chief. I've talked with the Petaluma deputy chief. We're all interested in doing this, and it's not a cheap model. So can we leverage all of our resources to provide broader services? So if you look at Rohnert Park, do they need a 24/7 operation, a little bit smaller city? I don't know, but that's why what Captain Cregan was saying, that's why we're doing this pilot program. We may be understaffed with what we're planning with Santa Rosa. We need to get the program, get the data, because I really want the data to drive our decisions regarding this program. So that's key, but it's going to be very much a regional approach. In the collaboration, one other thing that I know Bill and I both sit on the Continuum of Care Board for Sonoma County, which is focused on homelessness. And one of the reasons that we thought it'd be helpful to include the populations that are experiencing homelessness, because some have addiction issues, some have mental health issues, some just are lacking housing, right? So what if we can leverage those sources? Because right now with Continuum of Care, there's a tremendous amount of money coming down from the state and the feds to help with this population. So why don't we try to leverage that? Why don't we have the left hand talking to the right hand? And that's what we're bringing to it also. There's some emergency housing vouchers that the state just brought to Sonoma County that we're now trying to figure out the referral process for that. But I'm guessing some of those team and some of the street outreach team, our host team, will be working with this in response team, because again, it's all on the relationships where they actually be talking about real people, because these aren't just numbers, these are real people. and it's built on relationships. Because I think it's very apparent there is some mistrust in government, but once you have someone who actually builds a relationship, and we're going to be here, we're here to help you to kind of change that paradigm. And it's just integrating all these different systems, I think, is what our ultimate goal is. So I don't want to repeat pretty much everything else that John said, but I'm open to any questions.
Thank you very much. Will there be community outreach once this program is up and running? I know it's a program that you're obviously going to try to get the word out in the city so people know it's there, know how it's used, and know what its function is going to be. What type of community outreach will there be for this program?
So I think the first part is going to be educating the organization, like John was talking about with the dispatchers and officers, those that respond to these types of calls. This is an additional resource that will help you. And quite frankly, it could be a resource for those officers. Hey, can I talk to you? Because I had this call. I wasn't sure, is this the best way to handle it? Now we have this resource here. And then part of the responsibility of the team will be doing that public education. And that's why we're, the whole labeling and marketing, that was a big thing. I'm very appreciative of Chief Navarro setting aside some of his budget to hire a marketing, because that's not my wheelhouse. It's not in our wheelhouse. But let's hire some professionals, because we want that to be branded. So you see this van drive around the community, you know what that is. It's there to help. Same thing with the shirts and the marketing, the team that we put together. It's all part of that marketing. So that will be one of the responsibilities of the team, is to do that public education. And John, did I miss any other avenues or specifics about the public education?
The other one is just to continue to remind people at the Public Safety Subcommittee is that we're going to be giving our quarterly reports, lots of public comments, and that's available for anyone in the public. And I really encourage people to come, ask the questions, and make sure that we're staying on target. And then really working with NAMI and some of our nonprofits to be able to leverage them, and through the Santa Rosa Violence Prevention Partnership as well. A lot of key organizations are part of that. So they're going to be key stakeholders in making sure that we're successful getting the word out to our community, and that everyone understands what a great resource it is.
Thank you. Councilmember Bailey.
Thank you. I had a question. How do the officers and the firefighters feel about this program? Is this a program, us above have great ideas, and then, the people that really have to be part of it? So what is that feeling like? And then my second question is around sustainability. So it sounds like this is funded for 3 years, but there can be still some concern about sustainability in terms of funding. We're still talking about fires coming back to our community. Probably, I don't want to predict that, but that's a big concern going forward. So one, just how are the departments feeling about it, and then about the sustainability component?
Well, let me start with the sustainability, and I'll give my opinion about the police and firefighters' acceptance of this. The sustainability, it's budget priorities, right? And the things that the Public Safety Subcommittee has heard, unanimous support for this. This community wants this program. So the challenge in the expectation on the city council is find the money. I don't care how you find it. And that's what our challenge will be. So we're able to find, I don't want to say find, reallocate priorities to fund this first year at 1.1 million. Year 2 is 2.2, year 3 is 2.5, right? And again, that's where I say for the sustainability, because who knows what the future is going to bring, right? If revenue is decreasing, it's going to be a challenge. But I see this as something that there is that priority right now. And I think what our plan is, I think it is sustainable for it. But what we have to see, I can't predict, like you said, if we have, I don't even want to think what may impact that, but it will be a challenge, but it is a commitment from the council to continue to fund it. And just regarding the acceptance, if you look at some of the target populations that are going to be receiving these services, I think most officers or firefighters, high on their list is, I can't wait to go to one of these type of calls, right? And so I'm thinking this is something that I use the analogy when we first had chaplain service, law enforcement chaplaincy, there was pushback. It's like, what are they doing? Then all of a sudden you see what a wonderful resource they are, helping with some of these cases where you're doing a death notification, where someone can actually be there to help the family. They see what an asset that is. And I 100% fully think that that's where this is going to go out. I believe that's what eventually, once they start seeing it and see the benefits to the community, there'll be full acceptance. And I know John's talked with Tim from Cahoots, and you could probably talk about Eugene, what their experience was. But Scott and John, what are your thoughts?
Yeah, I think the same thing ties into what Councilmember was saying of just the education. So Chief Westrop and I have been talking with our staff and going to the briefings and educating them on what a new resource is going to be, not only for the community, but for our own organizations. And the police department acceptance, they're excited about it. They're happy to see what it is. And I actually just met with the Petaluma deputy chief this morning and talked to them about that. They did the soft roll of their team this week and talking about their officers, and they're the same, that they're like, wow, even in a few couple days of this is an exciting team to be able to add to our to support our personnel. So I think we'll see it, and I'll let Chief Westrop talk about the fire department.
Yeah, I'll just give you an example of sort of a litmus test that we did. And, you know, as we go through this process, it's obviously a change of working conditions. So we're meeting with our labor group, and I don't know if you've heard about police and fire labor groups, but they're strong, and ours is no different. And when I first sat down with the labor group, so the E-board, it was the old E-board with the old president, and broached the idea, I was a little skeptical. And it was probably one of the easiest meet and confers that we've been in. And then now we have a new president, a new E-board, and they're just as pleased with the idea. So it really is, to Councilmember Schwedhelm's point, it's something they're looking forward to as an additional resource to help them on a lot of different calls. And so they're looking forward to having that resource available to them. So it's just sort of an example of a small segment of the population of the fire department and where they're at with it.
Councilmember Estrada, you have some questions?
So I didn't have a question, just a comment. Evan, you mentioned community outreach, and I just want to plant a seed of thinking it of more community engagement, making it a two-way street. So not just outreach where you're putting out all this information, but also being proactive of hearing back from the community and having interaction. So just think about it more as engagement and not outreach.
Thank you. Councilmember Sullivan, do you have questions for our panelist, City Councilmember Schwedhelm?
Yeah, it was actually more, I guess, for John and Scott. I'm curious, are we going to have resources in fire and police that are going to be assigned to this project, or is this going to be whoever's available will get assigned? It sounded like what Scott said. For fire, it was going to have this specific person, right, with this specific background. Is that the same approach this police will take?
So the way we have it planned right now is it's going to be, you know, for the pilot period, at least what we're going to do is we're going to carve it out. They'll have the same job classification as any other firefighter, paramedic we have on the street, but they're going to be dedicated to the resource. So when they go through the specialized training and they're with the team, they're integrated with the team, they're making those connections, they're building that resource list, they're dedicated to that resource. So we're not just going to put anybody who, you know, we're not going to mandatory overtime hire somebody into that position. They're going to be dedicated to that resource. And we're going to have to figure out internally what that means. If somebody needs a vacation, we don't want the whole crew to shut down. So, you know, there might be some other people in there that have the training, but they're not on it full time. So we just want to really build the consistency and continuity into it this first year, particularly. But we also want to give people the opportunity of, even internally, there may be somebody who wants to go work that unit and get off the engine for a while. I don't know, that's happened in Southern California. Where they put it out to their internal crews first and said, before we hire people for this, do you want to do it? And they had people jump up and say yes. And good example for us is the pandemic response unit we stood up early into the pandemic. I didn't think anybody was going to jump at that thing, and we had more people than we needed volunteer for it. So they'll have the first opportunity, and we'll move them to that specialized unit. And if not, we'll hire people that are interested in that particular niche.
Great, thank you. Councilmember Landaverde, I see your hand raised.
Yeah, this might be too far in the future into the protocols question, but the vehicle, the in response Ford Transit vehicle is not going to have any sirens or lights. How will they display a urgency to getting to a call to the public, or if they're just going to have to just drive fast, or is there, or how does Eugene do it right now?
Yeah, so it's not an emergency vehicle. So yeah, you're right. They won't have the ability to do lights and sirens. They do have like some orange lights on it, just sort of more safety lights when they're parked on the side of the road and things like that. So they'll have to just respond like with a normal flow of traffic and to get there as quickly as they safely can. But then again, they're not going to situations which is involving like violence or someone getting hurt. So that gives them a little bit more time to be able to go there. And if it is something where someone's getting hurt, then a police officer and a firefighter units will still respond, secure that scene, and then hopefully they'll be there as quickly as possible.
Thank you.
Thank you. Okay, we're going to go now to Bill Carter. He is the division director with the County of Sonoma Behavioral Health. Mr. Carter, welcome.
Yeah, thank you. Thank you. A pleasure to be here. So the Department of Health Services has operated the mobile support team for a little over 9 years. So we have 9 years of experience responding to law enforcement requests for support on calls that involve or may involve someone in a mental health or substance use crisis. The program is operated as I described, which is it has been traditionally responsive only to law enforcement calls for support. It was designed to be a program that supports specifically law enforcement. Over the years, it's grown and shrunk and expanded again in response to the different funding sources that have supported it. Up to last year, we had teams that covered 4 of the 5 supervisorial districts and covered 8-hour shifts Monday through Friday. Last year, the board directed us to expand to add a team to cover the North County, so the 101 corridor in North County District, and to add Saturdays and Sundays. So we've been in the process over this year to recruit, to build out our teams to meet that expansion. We have, over the last 3-4 years, had interest in expanding the reach of MST. We think there's more to be gotten out of the resources that the county is expending. And so the opportunity that Santa Rosa offered us to join their team and to join their implementation of the in-response model was just ideal for us. We have been looking at adding different functionalities to our team. This opportunity to merge our team with the Santa Rosa team to expand its expertise and skills to include behavioral health and medical services, as well as homeless outreach and social services, was a great opportunity for us. So we, as soon as we got the invitation, we made the decision to pursue taking our Santa Rosa teams from our MST program and merging them in the Santa Rosa in-response teams. In addition to improving services, in addition to giving us a chance to leverage our resources better, I mean, we take a 2-person team that worked 1 shift and now spread them across 2 shifts because we're joining the Santa Rosa personnel. We're taking advantage of the training and technical assistance Santa Rosa is offering and the equipment and support. And I believe we bring a lot to the program as well. So we're bringing folks who have experience doing this. We have teams of people that are going to be able to rotate through to deal with coverage issues. And these are folks who are licensed and designated in the county to apply 5150 holds when they're necessary. And then lastly, our staff have strong connections to the other county programs. So we operate the crisis continuum, which includes the crisis stabilization unit and the upcoming psychiatric health facility, which opens in December. We have a variety of crisis residential and transitional housing programs, and we're also linked to the county homeless outreach teams. The one that originally responded to the Joe Rodota Trail, as well as a program that has been called Whole Person Care, and the interdepartmental multidisciplinary team. So we are in the process of talking with our employees and our unions, the administration, to move this partnership forward on our end. And for us, this is just one of the big innovations we're looking forward to this year.
Great, thank you very much. Are there questions for Mr. Carter regarding the behavioral health aspect and the county's involvement with the in-response model? Mr. Carter, one question I have is currently with the MST that's operating in the county, how many responses or how many calls for service does MST get from the sheriff's department that you are then going out to, as opposed to having it just being a police response?
So we respond to law enforcement agencies across the county, so city entities as well as the sheriff's department. Looking at fiscal years 18, 19, and 19, 20, there's roughly 171 direct calls. From those calls, we generate follow-up. So we do follow-up with individuals that are called out, with whom we have contact when we're called out as well.
Does anybody else on our panel or our CAC have current questions for Mr. Carter? Okay, we're going to then move on to our last panelist who is presenting this this evening. That's Director Mary Frances Walsh. She is from the National Alliance on Mental Illness, NAMI, here in Sonoma County.
Oh, hi, good evening, and thank you for having me. And I just want to clarify, I'm with NAMI Sonoma County.
Yes.
So, it is a national organization, and there are some 600 different chapters across the country. And our chapter serves anybody that's in Sonoma County. And we are not providers of mental health services. We are in the business of providing education and support for people who are impacted by mental health at any level. So we offer, NAMI as a national organization creates curriculum, provides models that we then carry out for our programs here in Sonoma County. So we have a class, for example, a course is an 8-week course that is open to anybody supporting somebody with a serious mental illness. So it's quite an intensive course, but it teaches them about these illnesses, what it's like for the person living with the illnesses, what kind of community resources there are, how to prepare for a crisis, how to handle a crisis. And we do a lot of education around what to do in the event of a crisis. We will be doing it to keep families aware of these changes in the system. And we always encourage people, for example, if they need to call 911, to ask for the mobile support team if it's possible. But we do a lot of explaining, what is the mobile support team? How does it work? How do I get them to come out to my home? We also, we offer weekly support groups for family members, and we hear stories, of course, of people's experiences in a crisis, and how those crises were responded to if they call 911. I mean, calling 911 from a family's perspective is one of the most difficult things they can do. They love that person they're calling about, and they're feeling overwhelmed. They don't know what to do, and they're calling it because they truly need help. Very, very often, the families are very happy with the services from, especially the police departments. There's a lot of good training, and they love it when the mobile support team is available and can come out, because so often when a person is in crisis, they need to be talked to, they need to be calmed, they need time, they need patience, they need somebody talking to them at eye level. They don't need to see the handcuffs or the flashing lights, and I'm sure the police department doesn't enjoy using them whatsoever. We also have a warm line. So we get calls, we get about 60 new calls every month. And those are from family members who are looking for help with dealing with somebody who lives with a serious mental illness. So I'm talking about an illness like schizophrenia or bipolar disorder or major depression, schizoaffective disorder. These are illnesses, that impact not only the person, but the entire family, because they're affecting somebody's thinking or behavior. And having one of these illnesses, we always say it's like a journey. So there are good times, there are bad times. Many individuals with these illnesses, especially schizophrenia and bipolar disorder, they cannot understand that they are sick. So they therefore refuse either their treatment or they refuse to take their medications, which make them feel uncomfortable. And their behavior can begin to build up either in an aggressive way, in an angry way. They could have episodes of being psychotic. All of those create havoc within the home, create distress. And so ultimately that is maybe when a 911 call happens. So we encourage people to be very careful when they call 911, to be very clear about what is happening, whether there is or is not a weapon involved, whether that somebody has been hit, whether furniture has been broken. So that kind of training is something that we will continue to do. And hopefully what we are trying to do is help people speak with a 911 dispatcher so that the dispatcher can make an informed decision about who is appropriate to respond to that call. We also get many calls from people who have a loved one in the Sonoma County Jail who has a mental illness, and very often a substance use problem, because it's very common that people self-medicate if they're living with a mental illness. They're also using substances. It's not everyone, but it is very, very common. But we can help people get information about their loved one or understand why the jail cannot offer them information because their loved one has not signed a release of information. But we can help clarify how they can provide information about their loved one to the jail. So what kind of medications has that person been on? What triggers that person? What makes that person better? Who is their provider of mental health care? The more information that can be shared about these individuals, the better. And we get a lot of calls from people who have a young person, for example, who has been taken to an emergency department at one of the hospitals for the very first time because they're feeling suicidal. And this happens with youngsters as young as 10 years old. Sometimes our hospital emergency departments are trying to handle this. And emergency departments in hospitals, I'm sure you all know, are high-tech, fast-moving places, or they should be more fast-moving. And they're really not a great place for somebody in a mental health crisis. Because what they need is de-escalation and patience, calmness, an environment that brings them down. And so if we can help people understand what the resources are in the community, what to do in the event of a crisis, what not to do, that's really our goal. We're about education because we believe that the more people understand these illnesses and what they can or cannot do to help their loved one, the better off they will be. We're totally supportive of this move to this new system. We think it's fantastic. We're very proud of our community. And we know it's going to take time. It's going to be working together. We work with Buckaloo programs quite a bit. And I'll just add one more thing, is that when a mobile support team is on a response to a crisis call in Sonoma County, if the family is open to it, the mobile support team actually contacts us and gives us the contact information for the family members. So we follow up with the family members always. So we will give them a call, we will email them, and sometimes we talk with them multiple times. So we're trying to give them a place if they just need to talk about what's going on and how difficult it's been, but we're also trying to introduce them to our educational programs, our support groups, and community resources. It's not just about NAMI resources, but what else in the community could they tap in to help them?
Great, thank you very much. Before opening up for other questions, I actually have a question. Ms. Walsh, what specific trainings, if any, from NAMI will the dispatchers receive, and will the officers on the Santa Rosa Police Department receive, such that they know that when calls are coming in, it should be handled by the in-response team as opposed to sending police officers armed to deal with that situation. And perhaps Captain Cregan, you have information about that as well. Since it seems like the dispatch is that's a very key part in this role. They're the ones who are deciding really whether it's an in-response response or whether it's a police response. What type of mental health training will they receive?
I will just say that we're not involved with the training for the 911 dispatchers at this point in time. But we have been a part of what we call crisis intervention training. And that's for law enforcement throughout the county, all of the agencies. And I've also done training inside the jail for the jail staff. You know, it's similar education to what we're offering families, but much more condensed. Talking about the what it's like to have a mental illness, what it's like for family members, and why it matters how we handle it, and why early treatment is better.
Thank you. Captain Cregan, can you tell us more about what specific training the dispatchers will receive and why they're not receiving NAMI training? And also what kind of training in general will your officers receive specifically regarding the mental health aspect of this, similar to what NAMI educates the families about? Why aren't the officers and the dispatchers also receiving that training?
Well, I'm not aware of NAMI having a training specifically tailored toward police dispatchers. They are involved, and all our officers go through that 36-hour CIT training that NAMI is a big partner in. But this is an opportunity for us to look at how we can work with NAMI, and maybe we work toward piloting a program. What I can tell you what we are doing is I have the dispatch policies from Eugene PD and from the Cahoots program of what's been working there for 30 years. So I have all of their policies. I'm carefully studying with that. I'm meeting with the Whitebird Clinic staff about exactly how they're doing it. I've had numerous meetings with Eugene PD they have a lieutenant who is administering the program there, the Whitebird Clinic or the Cahoots contract. So I've had a lot of talk with them about what they're doing well there in Eugene, and we're going to model that, but we're also going to self-critique. What can we be doing better? And I think our strong partnership with Mary Frances and the NAMI family, that we're going to be able to see how can we build our components here to make sure, because you bring up a good point. I mean, if from the moment that 911 call is getting received, if it doesn't get dispatched to the right team, then what really have we accomplished? And so that's going to be a key part about us, is us examining that call for service, and as many of the calls as we can, sending our in-response team, but balancing it with the safety of our team members on that team to make sure that we never put them in a position of danger, because then it loses credibility even with our staff there from the county of Sonoma and from our nonprofit and from our firefighters. So it's going to be that balancing. But what I will let you know is our goal is to send this team as many times as we safely can. And then also that's going to be getting the feedback from our community about where did we not meet your expectations with this, and then how can we get better? And that'll be a big part of that 1-year pilot program of us examining that and how often we got it right with those calls for service.
Thank you. Director Navarro. Yes, Director Navarro, you have your hand up for some question.
I have a question for any of the panelists, or maybe even Lieutenant Cutting might be able to speak to this. What discussions or progress has been made to draw the sheriff's office into partnership with the City of Santa Rosa's program? If anyone can talk about that a little bit.
Well, I'll let Lieutenant Cutting talk from their perspective. I can tell you a big part of it is the County of Sonoma, which works with the Sheriff's Department, is having Bill Carter here. So he's been a big key part of that, and ultimately they're responsible for the mental health services for that. So Bill and his department have been key partners from early in, and we've had conversations with the Sheriff's Department and keeping them apprised of what we're doing with the county's behavioral health services. And so they've been part of those conversations, and I think Bill and his team are taking lead on that, but Lieutenant Cutting may have more to add.
I don't have a lot more to add. I would just say that, yes, the sheriff's office has been working with Bill and his team for a number of years with the MST response and expanding that out in the county. The program that Santa Rosa is looking at right now is specific to the city and a condensed area. So we're also kind of watching to see how this works out And is it scalable into the larger county response area because our geographic area is so large?
Yeah, I would say the Sheriff's Department's always been an active partner in the MST program and has asked us about, our interest in the new projects that are underway. The sheriff's also part of a meeting with city representatives and the CAO's office in DHS to talk about the developing pilots in the county and to look for creating more opportunities for collaborative efforts.
Thank you.
Thank you. Council Vice Chair Barrera.
Thank you. Thank you everyone for all of the information. My question's kind of tied to what we were previously discussing about the reliability of dispatch. And you mentioned that you received information from Eugene on how they address calls and, what you're taking that information to make sure we develop something valuable here in Sonoma County. So did they give you any examples of when there might be errors in how dispatch takes in the call? Like, let's say, for example, the caller didn't know that there was a butterfly knife or something in someone's pocket. And now you have a situation where the person that is being called on has a weapon, but the in response team isn't supposed to handle situations where a weapon is involved. So did they have information on any situations where that might have happened, and how is that addressed? And is there additional training that the in response team would receive in order to address situations where something like that might happen and it turns out that there is a weapon involved or anything like that?
So we have had a lot of talks with them about just the dispatchers asking those specific questions and trying to kind of triage each one of these situations and make sure that the team is safe when they respond. But there have been times where the Cahoots team and Eugene has responded and they've needed to call for assistance. So, but overwhelmingly, they're able to handle it. I believe in their data they put for 2019 and 20 year, they called 250 times. They had a call for assistance, but sometimes that can be pretty minor assistance. And most of the time overwhelmingly, they're able to handle these calls. Talking to them too, because the safety of our staff on our in-response team is so important. I've talked to them in their 30-year history. They've never had anyone seriously injured in Eugene. He said he has and actually my main contact there, he's actually worked on the line level and worked himself up to one of the executives there. And he talks about he's been punched, he's been kicked, he's had minor incidents, but they've never had anyone seriously injured. And that really is a testimony. And he really talks about it is because they invest so much time on de-escalation and talking down these situations. And a big part of it is they're not going to someone who has known weapons or violence, but it's part of their having the increased training, having the expertise and a focus on de-escalation, and then us working very closely with our dispatchers about sending them to the right calls. And another part of it that we can't ignore, we still need to invest more resources into our police officer staff, because on those calls, like one of the panelists brought up about the calls that we're most worried about is when someone's armed with a knife or a gun and those lead to shootings, or maybe there's misinformation about them being armed. So we want to continue with the Santa Rosa Police Department, and I know working with the Sheriff's Department as well, to increase our crisis intervention training for our staff and make sure that they're better prepared on the calls that they respond to that don't meet the criteria for our in-response team to go to.
Thank you. And then my only comment, and this is just general. So the Cahoots program, I kind of see it as a program to more efficiently address calls, especially in calls where people don't want to have someone from law enforcement addressing them. And so I hope that the data collection gets taken very seriously, because I think that moving forward, that'll be something that you could use to justify why programs related to mental health need more funding, because it seems like when we're in a budget crisis, mental health programs are some of the first programs that receive budget cuts. And I think that this type of program is obviously going to justify the fact that there's a lot of need to invest more in mental health. And by making cuts elsewhere in those programs in the future, we're obviously not going to make a difference. So collecting data, I think, is going to be really important. So I think it's great that you guys are looking into that.
And we will. And actually another community group I just spoke with this afternoon, I presented to Homeless Action and Saves, and they're very involved with our unsheltered population. And they were asking too, of taking it further about us tracking what are the resources most needed? Is it substance abuse? Is it mental health? Is it just housing? And then for us to be able to look at the city and county to start saying, what resources do we need more? Do we need more long-term care beds for mental health? Is it more substance abuse or alcohol? Or is it now leading with more opioid? So we're actually going to hope to really see like, what are the users who are experiencing mental health and substance abuse? What are the resources they need most? And then do we have enough of those resources? So we're hoping to even be able to use that to get more data on even on those questions and help our county board of supervisors and our city council leaders and our other executives to be able to drive some of their decision-making going forward.
Great, thank you very much. Okay, if there are any other questions from our CAC members, we will go ahead and ask those. I don't see any at this time. So what I would like to do now, thank you to all of our panelists for your presentation. What I'd like to do now is open this up to public comment. This will be public comments specifically regarding this agenda item, regarding the In Response and the Cahoots Inspired Crisis Intervention Program. Once you are given an opportunity to speak, you will have 3 minutes to give public comment. I'm going to go ahead and open that up to Tony Winter as the first speaker.
Hi, everybody. Really great presentation. I have 2 comments / questions. One is I have concern about the equity piece with the county involvement in this program, and it's not equitably applied across the county. And I know there's intention to apply that, but I just want to express some concern about that there are plenty of other communities besides Santa Rosa that need this kind of crisis intervention. So that's one thing I wanted to bring up. The other thing is, as a nurse, I know how much stigma there is around mental health issues in our culture in general. And I would like to see a more neutral term on the In Response van and in the logo that neutralizes that stigma by calling it crisis intervention or crisis stabilization or something that doesn't. I wouldn't want the mental health intervention team to show up in my driveway or in my neighborhood and have all my neighbors know that I was having some kind of crisis. So I think that's a serious issue. It's very unfortunate that we have that stigma, but just know it's out there. So I think that needs some evaluation, and I yield the rest of my time.
Thank you very much. Our next speaker is Deborah McKay. It looks like Deborah was led on. Deborah.
Yes, I really want to commend the city of Santa Rosa for moving forward on this and taking a risk and bringing these services to the community. And I know your resources are limited. What's going to happen if you get multiple calls for these kinds of services? Can you respond to more than one call? And if you get multiple calls, what's your plan?
Great question. Captain Cregan, what is the plan if there are more than one call for service at the same time for in response?
And we're planning for that. And that's why we're really working toward building the capacity of this team as quickly as we can. So for the first year, it's going to have just the one car. And we expect that sometimes there will be several calls stacked up or pending, just like police or fire units do right now. And they'll kind of prioritize them based on the need and be able to respond. But that's why we want to, as quickly as possible, have these overlapping teams. So there could be 2 teams and even 3 teams during our peak times that could be working as we get to the full 24/7 response model. So at first, for year 1, if there were 3 calls pending, then they'd get prioritized by the need. And if it was someone who's in an absolute crisis, they'll go there first. And if it's someone else who's maybe just feeling depressed or feeling emotional and needs some support, then that would maybe be the call that would have to wait. And then ultimately, if they're tied up for hours and not available, then we'll have to go to the resources that are available, sending through the traditional police and fire response. But that's why I think it's urgent for us to get to this full 24/7 response model as quickly as we can and have the resources available that our community needs.
Great, thank you. We're going to now go to Richard DeLeon.
Thank you. Thank you for the time. Couple thoughts, and I don't know if they're really questions, but one thing in the spirit of collaboration, I know that Napa has begun a program similar to what you all are talking about. It may be even like on a smaller scale, but someone that you all could reach out to would be James Thompson out of Napa, and I believe they're doing it through the city of Napa. And then the other thought, or just as you were talking earlier about the van, if there's, again, in the spirit of collaboration and engagement, maybe there's a way that community members could be the ones designing what the logo looks like. And, you know, there's some sort of prize that goes along with it. I actually think the in response is not a bad idea, because you can also easily translate that to Spanish to like en respuesta. So en and a respuesta, which could be something that just, you know, people go like, oh, they're here to respond. So I'm excited to see where this goes, and I think it's long overdue.
Great. Thank you very much, Mr. DeLeon. Next up, we have an individual labeled Michael, just Michael. Please go ahead and speak once you are called in.
My last name is Hilbert.
Thank you, sir.
Okay. I object to this whole thing. I'd rather see this defunded. The county of Sonoma and San Rosa in particular is up to its ears in methamphetamine. And I see this as a way to, you know, cover up your failing to deal with the problem of drugs in this county. The reality is we'll see young guys smoking crystal meth with a glass crack pipe in broad daylight, getting high every single day, and a blind eye is turned to it. Until there's some sort of fight or altercation or something, there's no proactive response. Drug dealers have been reported to be seen traveling around on a regular basis, distributing as if they're legitimate licensed business persons. Unless you get serious about understanding, you know, that methamphetamine use is criminal activity, and you want to speak to how do you get rid of it, you know, I don't see that this is appropriate. I'll give you some examples, more concrete. For example, you had a vehicular homicide on Roberts Avenue. You had agitated, amped up methamphetamine users living there, and it was ignored. Illegal drug use was ignored, and you know, it's not surprising that it led to a fight, and in that case, it became a fatal confrontation. But you got to intervene, and when you see someone under the influence of methamphetamine, you know, do the search and find out where they got it from and try to follow up. And you'll send the message that, you know, getting high on meth every day is not acceptable around here. You know, it's not really a mental health issue. It's more of a criminal matter. I see this as really an excuse to waste money to cover up for your failing to deal with the problem of illegal drugs in this city, in this county. So that's my main point, and I'll leave it there.
Thank you, sir, for your comments. I do not see any more hands raised at this time for our public comment on this agenda item. So I will, at this time, close public comment for item number 3. I want to thank all of our panelists again for this discussion. It was very helpful and very informative information that you provided to us. It's very much going to help us look at this program over the next year as it goes through the pilot, so that we can see its success, hopefully, and of course, see how it might be scalable, as Lieutenant Cutting said, to expanding to something like the full county-wide services. So the program sounds great. It looks like it's been doing wonders in the other states and cities where it's been implemented. And hopefully we can have the same response here in Santa Rosa once that gets going later on in October. Thank you all for your appearances and for joining us at the meeting again. If we have further questions, I hope you don't mind if we email you and follow up with you by email. And again, we have a few more agenda items to address, but for those of you on our panel, you don't have to stay. And we thank you very, very much for
Thank
attending
you.
tonight's meeting. Thank you very much.
Thanks so much for having us.
Of course.
Thank you.
Okay, now I am going to turn to item number 4 on our agenda. That is the director's report from Carlene Navarro. Hi, Carlene.
Hi, good evening, everyone. I just wanted to take a brief moment to acknowledge and address the recent decision affecting Measure P that was made by PERB. So as many of you, if not most of you know by now, the Public Employment Relations Board, known as PERB, issued a decision last week about Measure P in response to labor complaints filed by the Sonoma County Law Enforcement Association, which is known as SCALIA, and the Deputy Sheriff's Association, which is known as DSA. And PERB's ruling declared provisions related to IOLERO's investigatory power, subpoena power, ability to post body-worn camera videos, authority to make discipline recommendations, what they called void and unenforceable. And IOLERO has been ordered to cease and desist from engaging in any investigations or other conduct related to the provisions that were voided by PERB. The gist of PERB's ruling is that the provisions of Measure P affect the labor conditions of the Sheriff's Office employees and should have been discussed during a meet and confer process before Measure P was placed on the ballot. And I think it's important to emphasize that PERB's decision to avoid these provisions was not based on the constitutional or the legal merits of the provisions themselves. And that means that it has not been deemed unlawful for IOLERO to investigate the Sheriff's Office independently, to recommend discipline, to post body-worn camera videos, or to issue subpoenas. PERB's decision voided the provisions based on the lack of a meet and confer process. It was a process issue and not a legal merit issue of those provisions. I wanted to let you know that County Council and IOLERO and Labor Council have been exploring and discussing the various options for how to respond to PERB's decision. And those options are going to be presented and discussed tomorrow with the Board of Supervisors in a closed session meeting. It's imperative to remember that no matter how this plays out, and the fact that nearly 65% of Sonoma County voters expressed their desire for increased oversight of law enforcement cannot be ignored. And everyone involved will be reminded to keep that detail as a top priority during the decision-making process. So while the county continues to evaluate the PERB decision and its next steps and options, IOLERO will continue with our existing work and implement all the provisions of Measure P, which were unaffected by the procedural challenge in the meantime. So if you have questions about any part of this, please feel free to reach out to me directly, and I'm happy to talk about it anytime.
Great, thank you. Director Navarro, is that your entire report?
It is. That was all I wanted.
Perfect. Thank you so much. At this time, I will open up the agenda item number 4 to public comment. If there are other people who wish to give public comment regarding the director's report this evening. Okay, I do not see any hands raised. We will close public comment for item number 4. And at this time, we will go to item number 5 on the agenda, a vote to submit the final draft of recommendations of the sheriff's policies to the Sonoma County Sheriff. In our agenda items this evening, you all received copies of the agenda items and the policy recommendations that we intend to send. Those do include both use of force policy recommendations, as well as what's described as the overall overreaching de-escalation policy that we intend to send as well. So the first thing I will do is we're going to now look at the de-escalation policy. And if there is anybody who has not reviewed the de-escalation policy, please let us know so that we can take that into account during this vote. Is there anybody who has not had an opportunity to review the de-escalation policy that we are now voting on?
And then I actually want to make some comments from the de-escalation ad hoc.
Sure, please.
If that's okay, should I do it now? Is okay?
Yeah, please.
So I just wanted to say that we did, after our last meeting, meet as an ad hoc to try to talk about the public comment that was made. And some of the things that we did discuss was, that was brought up, was alternatives to law enforcement. And we do believe that we covered that on page 4 of the de-escalation policy and pre-engagement techniques. We also talked about, and these are all things that were brought up in public comment, but de-escalation being a global approach to everything. So we did request that the policy be placed first in the policy manual to emphasize how that should be a global approach. Something else that was mentioned was cultural shift, and we do truly believe that this policy being accepted by the sheriff's office is the first step. And then consequences of not using de-escalation and stronger accountability. That is something that we could not at this time incorporate in our policy, but we do know that this will be a discussion item at a later meeting. So it's just public comments that we as a de-escalation ad hoc wanted to address.
Great, thank you very, very much for addressing that. Are there any other comments from our CAC regarding the de-escalation policy that we intend to submit to the sheriff this evening? No? Okay. Then I will go ahead and take a vote at this time. All those.
Do we have to do a motion first? Because if so, I'd like to move that we submit the de-escalation policy as presented in the most recent agenda packet to the Sheriff's Department for possible adoption.
Thank you. Yes, we did need a motion, and I appreciate that motion. Is there a second to that motion? I see Councilmember Estrada is seconding that motion. Therefore, I would like to take a vote now. All those in favor of submission of the de-escalation policy that is contained in our agenda packet, all those in favor of submitting that to the sheriff, please vote with your hands raised and an aye.
Aye.
Aye. Okay. Councilmember Sullivan, I wasn't able to hear you. Oh, there you go. Okay.
Aye. Yep.
Great. Thank you. Okay. All those opposed to filing this and submitting it to the sheriff? And I hear no responses. Okay. So that de-escalation policy will be submitted to the sheriff's office and to Sheriff Essick this evening. And we'll do that right after our meeting this evening. Now moving on to our next use of force policy. Is there a motion for the approval and the submission of the use of force policies that are included with tonight's agenda packet to be submitted to the sheriff?
I'll go ahead and make the motion to submit for consideration possible adoption.
Great, thank you. Is there a second to that motion?
I'll second.
Thank you, Councilmember Bailey. And now, is there a vote, please? I would like all those in favor of submitting these policy recommendations for use of force to the sheriff. Please raise your hand and vote with aye.
Aye. Aye.
Okay, I saw all responses. Any opposition, please raise your hand and state no or nay. Okay, I hear no negative responses. So we will then go ahead and submit. Before we make that final vote, let's take a public comment. Before we enter those votes, let's open up to public comment. If there's anybody who wishes to give public comment on the submission of the recommendations to the sheriff's office. I see no hands raised. Therefore, we will go ahead and enter those votes, all in favor of submitting these to the sheriff. I will send this packet tonight, right now, when we conclude our meeting, to both Sheriff Essick with a copy to Lieutenant Cutting, and I will, of course, await their response. We will go now to item number 6 on public comment, or rather on our agenda. It is for public comment. This is for items not appearing on the agenda, but within the subject matter jurisdiction of the CAC. If you would like to give public comment, please state your name and who you represent. And please go ahead and raise your hands if you wish to give public comment. I see nobody raising their hands for public comment this evening. So with that, I will go ahead and close tonight's CAC meeting for July 12th, 2021. Our next CAC meeting will be held, let me actually check. It is going to be on August, let me see here, August 2nd. It will be Monday, August 2nd. And we do not yet have a location for this CAC meeting, but we will announce that shortly. It will most likely be available in person for the CAC to attend in person. We are looking into whether we will have Zoom capabilities as well for our public, but I do believe that we will be open for the public to attend the next CAC meeting. And as soon as we know the location, we will provide that information to the public and our CAC members.
Evan, I wanted to say I am looking into, first of all, wanted to see if the state will allow us to do an in-person meeting.
Oh, okay.
I was able to get confirmation we can do an in-person meeting, but it's looking more like maybe the September meeting will be in person.
Okay.
So we may still have one more meeting via Zoom. I
Okay.
will let you know this week.
Thank you for letting us know that.
And also, Evan, to follow up on that, we're also looking into having the capability to offer some sort of Zoom or remote in for guests so that we can continue to have guests from, different locations and other states and make it easy for guests to appear at the meetings so that we can continue to have a diverse and wide array of panelists at the meetings.
Yeah, that would be fantastic.
Right. The logistics of a hybrid meeting might be a little challenging, but I actually spoke with someone today and they're doing it very easily at their location. So that may be where we have our meeting in September because they can do it. So we'll see. Yeah.
Wonderful. Well, thank you very much. We will update everybody as we get more information about that. Again, welcome to our new member reappointed and to our reappointed members. Thank you for joining us again. I look forward to seeing everybody at our next meeting. Thank you. This meeting is adjourned.
Good night, everyone.
Good night.
Good night.